Hello, I'm Pat Nixon, lead nurse consultant for iNurse Delegate. Today I'd like to introduce you into the world of nurse delegation. According to the Texas Board of Nursing, nurse delegation supports the client's preference in the provision of health care, including the choice and control for delivery of services in a community-based setting. The primary goal is to assist the choice of the client to achieve the most integrated and least restrictive environment throughout their lifespan. This is regularly accomplished in part through the assistance of unlicensed personnel who work with the client to complete a variety of daily tasks. Tasks considered as nursing tasks in the acute care setting are considered support services. These services are necessary to assist the client in maintaining optimal health coupled with the highest degree of independence and quality of life while living in an independent environment. There are a couple of terms that you should be familiar with. Client, the individual receiving care. Client's responsible adult, also called CRA or LAR, is the individual who is 18 years or older, chosen by the client who is willing and able to participate in decisions about the overall management of the client's health care and to fulfill any other responsibilities required under this chapter for care of the client. The term includes but is not limited to a parent, foster parent, family member, significant other, or a legal guardian. Administration of medications. Removal of an individual unit dose from a previously dispensed, properly labeled container, verifying it with the medication order, giving the correct medication and the correct dose to the proper client at the proper time by the proper route, and accurately recording the time and dose given. Assistance with self-administered medications. Any needed ancillary aid provided to a client in the client's self-administered medication or treatment regimen, such as reminding a client to take a medication at the prescribed time, opening and closing a medication container, pouring a predetermined quantity of liquid to be ingested, returning a medication to the proper storage area, and assisting in reordering medications from a pharmacy. Functional disability. A mental, cognitive, or physical disability that precludes the physical performance of self-care tasks, including health maintenance activities and activities of daily living. Delegation. Authorizing an unlicensed person to provide nursing services while retaining accountability for how the unlicensed person performs the task in the presence of a registered nurse. Unlicensed person. A paid individual who is not licensed as an RN or LVN and is not part of a formal education program for nurse licensure. Health maintenance activities, or HMAs. Tasks that may be exempt from delegation based on an RN's assessment that enables the client to remain in an independent living environment and goes beyond ADLs because of the higher skill level required to perform. The RN may reasonably conclude based on assessment that these tasks are exempt from delegation based on the client's condition. There are two main agencies in the world of delegation: Texas Health and Human Services and Texas's Board of Nursing. Let's talk about the basic criteria for delegation. The client must be in an independent living environment, be at least 16 years of age, or have a responsible adult that is willing and able to participate in the decisions of overall management of the client's health care. The task must be for a condition that is stable and predictable. The RN, in consultation with the client or the client's responsible adult, must make an assessment to determine if the task is a task that can be delegated. This means that the task either qualifies as an ADL or HMA not requiring delegation, the task can be delegated to an unlicensed person, or the task should not be delegated and can only be performed by a nurse. So you're probably familiar with activities of daily living, also called ADLs. These are tasks that may be performed by unlicensed persons without being delegated. These tasks can be performed for people with functional disabilities, and they're likely tasks that the client could perform by themselves if it weren't for that disability. Let's talk about health maintenance activities that do not require delegation. So, according to the TAC, health maintenance activities may be performed by an unlicensed person without being delegated when they're being performed for a person with a functional disability, and after an RN determines that all of the following conditions exist. Number one, the client would perform the task if it were not for their functional disability. Number two, the task can be directed by the client or the client's responsible adult to be performed by an unlicensed person without RN supervision. Number three, the client or client's responsible adult is able and has agreed in writing to participate with the supervision of the unlicensed person's actions in carrying out the task, and either A, the client is willing and able to train the unlicensed person, or B, the client's responsible adult is capable of training the unlicensed person in the proper performance of the task. Now, that person must be present when the task is performed, will have observed the unlicensed person perform the task at least once, and will be immediately accessible when the task is performed. As a nurse, when determining whether to delegate a task or those ADLs or HMAs requiring delegation, the RN, in addition to the assessment, must determine that the task does not require that the unlicensed person exercise nursing judgment. The nurse must also verify the experience and competency of the unlicensed person, including the unlicensed person's ability to recognize and inform the nurse of client changes related to the task. The RN must have either instructed the unlicensed person in the delegated task or verified the unlicensed person's competency to perform the nursing task based on personal knowledge of the training, education, experience, and or certification of the unlicensed person. The RN, in consultation with the client or the client's responsible adult, must determine the level of supervision and frequency of supervisory visits required and the nature of the nursing task to be delegated. The registered nurse or registered nurse qualified to supervise the unlicensed person should be available in person or by telecommunication when the unlicensed person is performing the task. The competency of the unlicensed person to whom the nursing task is delegated must be adequately documented. So, what are the nurse's responsibilities in delegation? Number one, assessment. The nurse must assess both the resident and the caregiver. Care coordination amongst the resident, the community, and the client's responsible adult, as well as outside providers such as home health and hospice and state surveyors. The nurse is responsible for training and supervision, as well as the evaluation of all nursing tasks performed. Let's talk about some tasks that may be delegated. So some ADLs may actually be determined to require delegation. This may include monitoring of certain vital signs, non-invasive and non-sterile treatments with low risk of infection, collecting, reporting, and documentation of data, reinforcement of health teachings provided by the registered nurse, the insertion of tubes into a body cavity, instilling or inserting substances into an indwelling tube, ventilator care, trach care. This includes instilling normal saline and suctioning of a tracheostomy, routine supplemental oxygen administration, care of broken skin with low risk of infection, as well as some sterile procedures, those procedures involving a wound or site that could potentially become infected. Medication administration. This includes orally, via feeding tube, sublingually, topically, eye, ear, and nose drops and sprays, vaginal or rectal gels and suppositories, inhalers, as well as oxygen administration for the purpose of non-acute respiratory maintenance, administration of oral unit dose medications from a daily pill planner, administration of subcutaneous insulin, and certain emergency measures. Here at iNurse Delegate, we are here to support your nursing delegation needs. This includes training of direct care staff, competency evaluations, annual clinical compliance, as well as delegation, including resident assessments, medication administration, supervision and training of other nursing tasks, nurse management consultation, including the development of policies and procedures, policy and procedure review, nurse task and duties review, as well as staff development. We'd also like to partner with you in infection control management, including the review and updates of your policies and procedures, staff training, and implementation of nurse tasks. Thank you so much for joining us. We look forward to working with you and your team to establish delegation.